Welcome to the Wellness Connection with Dr. McMinn. Dr. McMinn is Birmingham's wellness doctor, practicing cutting-edge, world-class wellness medicine at McMinn Clinic in Homewood, Alabama. Each week, Dr. McMinn interviews experts in the field of integrative wellness medicine. The Wellness Connection brings you the information you need to optimize your health in mind, body, and spirit. And now, here's Dr. McMinn.
And welcome back once again to the Wellness Connection with Dr. McMinn, and we're here with Misti once again talking about heart disease today. Misti, we're talking about some of the things you can do to help prevent heart disease, and before we move on to metabolic syndrome, I did want to talk about the role of stress and stress reduction. That can definitely take its toll on the heart. So as much as we can, controlling stress, managing stress can be quite helpful.
You know, everybody has stress, and when I say manage stress to people, they're like, okay, what am I supposed to do? You know, like meditation and finding what works for you, and, you know, prayer, you know, finding something that works for you.
Yeah, that's all.
It's the main thing.
Well, I think we've had specific shows on stress.
We've had the whole show on that,
so,
but just in case someone wasn't listening, you can effectively manage your stress. You can't make it go away. I wish you could. But.
Well, you can go back to one of our previous podcasts, can't they, Misti, and take a look at that, and just go to the website, McMinnClinic.com, go to a previous podcast, and we can talk all about managing stress on that podcast. So, anyway,
well, I want you to explain a little more about what exactly is metabolic syndrome for those people out there that may not be aware of the actual condition of metabolic syndrome.
Okay, listen up, y'all.
Pay attention.
Some of y'all out there might be having metabolic syndrome and not really recognize it.
Probably a lot of people.
But I'm sure if you ask your doctors, they'll know exactly what we're talking about and be able to get you plugged in with a good program. But metabolic syndrome is truly a complex syndrome. It involves excessive weight, especially around the middle, inflammation, we talked about that before, insulin resistance, increased blood sugar, hypertension, and what we call lipid abnormalities, especially high triglycerides and low HDLs. HDLs, of course, are the good kind. So here's how you make the diagnosis. It depends who you talk to. There are different criteria, but I go with the one by the American Heart Association. I think that's the most widely accepted one. And what they say is that there are 5 criteria for metabolic syndrome to make the diagnosis. So what you do is just go through each of these 5, and you see how you're doing on these things. And by definition, if you have 3 out of 5, then you qualify for metabolic syndrome. You have metabolic syndrome. So let's go through them. Number 1 is abdominal waist circumference, and that would be a waist circumference greater than 40 inches in men or 35 inches in women. There we go, Misti being sexist again, right? Okay.
But it's not your pant size waist. Right. It's more that hip measurement almost where your belly hangs over.
So it's that waist circumference is number 1. Number 2 is high triglycerides over 150. Number 3 is low HDL. HDL, once again, is the good cholesterol. So you want more of that. So if your HDL is low, if it's less than 40 in men or 50 in women, then you qualify. Number 4 is high blood pressure, over 130 on the systolic, over 85 on the diastolic. That is 130 on the high number, 85 on the low number. And then a fasting blood sugar over 100. So those are the criteria. So once again, if you kind of go back and take a look at your lab work and your waist circumference, etc., and you might find that, gee, I've got 3 out of 5, which means you have metabolic syndrome.
Well, some of those things, you know, you would have to go to a doctor and have your blood drawn. But if you're, you know, if you're sitting there looking at yourself and your waist is, you know, more than 35 or 40 inches, and you have a family history of cholesterol issues, and you may be having some blood sugar or blood pressure issues, then you may want to get it checked out.
Might want to check it out. Yeah, a lot of people have old labs laying around too. They can just kind of go back and look at their old labs, and I know a lot of my patients will track and monitor their labs.
I tell people to keep their labs from all their physicians. That way they have a record of what's been going on with their health over time.
A couple other conditions that are also suggestive of metabolic syndrome but not part of the real criteria would be a fasting insulin level greater than 10, an elevated C-reactive protein, we talked about that earlier, and a hemoglobin A1C. That's a measure of your sugar function over the last few months, and if that's greater than 5.5, then once again, suggestive of metabolic syndrome. So
what is a normal fasting insulin level? It says greater than 10.
Yeah, normal, Misti, if you'd like to be less than 10.
Less than 10, period. Okay.
Yeah, you'd like to be less than 10.
Okay.
So let's say if you fall into the criteria, well then what to do? So I think when it looks at treatments for metabolic syndrome, there are basically three things you want to do. I think that the diet is huge.
Yeah, low glycemic and
right, exactly, the low glycemic index diet. And so what that means is, as best you can, cutting out the sugars and things that act like sugars, like the whites, the white bread, the white pasta, all those kind of things. Anything that processes quickly and raises your blood sugar. Number two is the exercise. That's huge, and you definitely want to shoot for about 2/3 cardio and one third strength. With metabolic syndrome, the number one thing that burns off your sugar is your muscles, so you definitely want to get some strength training. And I tell my patients that you really need to go after 5 days a week on the exercise, and you need to take a no excuses policy. Okay, and the third thing, Misty, is what we call an insulin sensitizer. Because you want to make sure that when you get those carbs and those simple sugars, that they get processed properly and they get stored in the cells, not stored as fat and as triglycerides.
Yeah, and cinnamon is an effective, over-the-counter method, I guess.
Right, as far as over-the-counter,
Yeah.
I'd say chromium would be number one.
Chromium or cinnamon.
Chromium picolinate especially, and the cinnamon can also be good. However, if you're going to go with medications, then my favorite drug is going to be called metformin, METFORMIN, which is a wonderful insulin sensitizer. Has a pretty good side effect profile, very safe, very effective.
And you can take metformin without being diabetic. I have to remind people of that on a daily basis. That it's not just for, it is a type 2 diabetes medication, but you can also take it for metabolic syndrome.
Well, Misty, metabolic syndrome is one of those conditions that it's bad news if you don't deal with it, because metabolic syndrome, by definition, is pre-heart disease, pre-diabetes, pre-stroke.
Yeah.
But I've had so many patients, if you get busy with it at this stage, then you can just make it go away completely. And that's very powerful.
There's a lot of information available out there on the low glycemic index diet. If you just go to Google and type in low glycemic index, it'll give you a list of all the foods that are on that lower end of the glycemic index, which is not the kind like the white stuff that raises your blood sugar up really fast and kind of keeps it there for just a second. More the complex stuff, complex carbohydrates and stuff.
I'd say, once again, the veggies are the way to go. Some fruits are okay, but especially the veggies. You want to get lots of fiber. Some moderate protein is fine. Some of the good fats are quite good for you, actually, especially the omega-3s. Low sodium. And low in refined grains, once again. So that would be the way to go as far as your diet is concerned.
So tell us more about the role of inflammation in heart disease. That's a biggie, right?
Yeah, Misty, there's a wonderful author named Dr. Russell Blaylock, I think it's B-L-A-L-O-C-K. He is a neurosurgeon, actually. He wrote some good papers on this issue, and he feels that inflammation is really the root cause of most diseases. And so, once again, how do you know if you have inflammation? There are many ways, but I think the best lab test is going to be the C-reactive protein. Yeah, for sure. And so, when it comes to inflammation, we get after it at the clinic, and we try to improve upon that. Inflammation, there are what we call acute inflammation and chronic.
Right.
Acute is like if you sprain your ankle, it gets inflamed.
Right.
But what we're talking about is chronic inflammation. It's where you have continuous demands by the body on the immune system. It kind of breaks things down, and then you can get all sorts of diseases from that. Even things like, say, autoimmune diseases such as lupus, MS, can be related to inflammation and immune dysfunction in that way.
What causes inflammation? Is it mainly from our diet?
Well, that's a great question, Misty. There are many different causes, and certainly diet is one, especially the high sugar diet. Your body was not meant for sugar. Number two would be excess of insulin. We kind of talked about that earlier, how we get insulin resistance. Stress, depression, toxins. Heavy metals, especially, can cause inflammation. And, of course, we do a lot of heavy metal testing at the clinic, and we see a lot of people, when they least expect it, are going to be loaded with mercury, lead. All that kind of stuff.
Even cadmium.
So, smoking, drugs, both illicit and prescribed, can cause inflammation. Caffeine, all those things. There are many different causes, and so we'll come back right on the other side of a quick break, and we'll talk about how we can try to reduce inflammation. And we'll see you back in about 1 minute on the Wellness Connection with Dr. McMinn.